Hello! Entertainment Studios and Access Healthcare welcome you to Birth Control, Your Options. This module is part 3 of a 4-part series on birth control. Birth control, also known as contraception, is designed to prevent pregnancy. Birth control methods may work in a number of different ways, from preventing sperm from getting to the eggs to keeping the woman's ovaries from releasing eggs that could be fertilized, into sterilization, which permanently prevents a woman from getting pregnant, or a man from being able to get a woman pregnant. Your choice of birth control should depend on several factors. These include your health, frequency of sexual activity, number of sexual partners, and desire to have children in the future. Your healthcare provider can help you select the best form of birth control for you. In this course, the objective is to help you know how effective are each type of birth control and what are some of the myths and facts. Wondering how well different types of birth control will prevent you from getting pregnant? The chart on this slide ranks the methods in order from most to least effective. It also tells you how many women can expect to become pregnant in a year with typical use. Don't listen to rumors, you need to learn the facts. Myth 1. I need to take my birth control pills at the same time every day. The fact is that it is important to take the mini pill at the same time every day for it to be effective. But you can take the combined birth control pills around the same time every day, and they will still be effective. If you miss one or more pills or start your pack late, ask your doctor for how long you need to use a backup method of birth control. Myth 2. Antibiotics make the pill less effective. The fact is that the only antibiotic that is proven to interfere with a pill's effectiveness is a medicine that treats tuberculosis called rifampin. Besides this, antibiotics will not increase your chances of becoming pregnant. Other medicines that may interfere with the pill include certain HIV medicines, anti-seizure medicines, and antifungal medicines. Talk to your doctor to make sure your medicines are safe to take with your birth control. Myth 3. Birth control will make me gain weight. This is one of the most common worries doctors hear from their patients. But in many studies, the only type of birth control that showed a direct link between weight gain and birth control is the injection. However, if you experience weight gain or any other side effects from your birth control, talk to your doctor. Myth 4. I can't get pregnant if I have sex during my period. The fact is that it is possible for you to get pregnant at any time during your cycle. That is because sperm can live in your body for 5 days. Your risk depends on your individual cycle and when you ovulate. Myth 5. It is not healthy to use birth control that makes you skip your period. Some women think that if your birth control makes you not have a period, blood is building up in your uterus. Other women feel like it is unnatural to not bleed every month. The truth is that birth control can make the lining of your uterus so thin that it does not need to shed and leave your body when you get your period. It is not actually building up at all. Myth 6. You can't get pregnant while you're breastfeeding. Many new moms who are breastfeeding go months without menstruating after having a baby. That is because breastfeeding can affect the hormones that make you ovulate. But this is not always the case. You can still ovulate while you are breastfeeding, especially if you are supplementing with formula. It is important to use birth control as soon as you feel like having sex after giving birth. Talk to your doctor to learn the best options for you. Myth 7. Taking birth control will make it harder for me to get pregnant when I'm ready. The only method of birth control that will prevent you from ever becoming pregnant is sterilization. With one other exception, you could actually get pregnant as soon as you stop taking birth control. If your birth control method is the injection, you might not be able to get pregnant until 24 months after you stop using it. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Here are some other sites for more information. Do your research so that you understand your options. Thank you for joining us today for part 3 of this 4-part series on birth control, and come back for part 4.